Thank you. Chairwoman Kiggins, Ranking Member Ramirez, I am grateful for this opportunity to discuss the OIG's independent oversight of VA's mental health services. The OIG recognizes that meeting the complex needs of veterans requiring mental health care comes with extraordinary challenges. The Office of Healthcare Inspections routinely assesses VHA's services and how well they address those challenges. Our clinical teams regularly make recommendations to improve VA's delivery of health care through reviews of mental health and suicide prevention programs, inpatient mental health units, reports of harm to patients at individual medical centers, as well as inspections of vet centers. OIG recommendations for corrective action are based on identified deficiencies and noncompliance with VA policies and established standards of care. As my written statement details, deficiencies can be grouped into 3 stages of suicide risk reduction interventions, with the first focused on screening and assessing veterans' risk. A December 2024 OIG review of VHA's suicide risk screening compliance found that in fiscal year 23, the annual adherence rate was just 55%. Interviews revealed that the reasons for noncompliance included staff feeling uncomfortable with initiating screening and lack of clarity for who should be overseeing the staff compliance. A tragic example of a failure to properly assess a veteran was documented in an OIG report that found a veterans crisis line responder did not fully assess a caller's alcohol impairment and access to lethal means. Shortly after the call, the veteran died by suicide. The second stage of risk reduction is the effective management of acute care needed after a veteran's suicide attempt or ideation. In 2 separate 2024 hotline reports, our teams found noncompliance with mandates to remove belongings from a patient that could be used in a suicide attempt, and with requirements for staff's one-to-one observation for a patient with suicidal ideation. In both instances, the veterans attempted suicide during their hospitalization, and tragically, one died. Our mental health inspection teams consistently review the environment and care practices of VHA's acute inpatient mental health units, repeatedly finding lapses in preparing patients for discharge. Because the highest risk for suicide occurs within the first 30 days after hospitalization, VHA staff should unfailingly carry out activities such as pre-discharge screenings, determinations of access to lethal means, and a suicide prevention safety plan to confirm that a hospital discharge is appropriate and safe for each patient. Third, while the tragedy of a veteran's suicide can overwhelm survivors and healthcare teams, lessons learned can and must support efforts to reduce future suicides. Our work has identified numerous delays and deficiencies in important internal VA reviews after a veteran completes suicide, including root cause analyses, peer reviews, institutional disclosures, and family interviews. Such delays not only impede improvements, but also deprive loved ones of important grief management resources. The last report in my statement was published just last month on the role of VISN Chief Mental Health Officers. Across these 18 regional networks, the Chief Mental Health Officers reported they lack clarity about their role and the authority to effectively address staff noncompliance. In effect, VHA's governance structure may contribute to problems with performance and hinder opportunities for process improvements. There will never be a single solution to the devastating problem of veteran suicide. Still, we must continue to work towards saving every life. That means not losing sight of what needs to happen today and every day, providing wraparound services that treat known risk factors for suicide, from prevention such as anxiety and depression management, substance use disorder interventions, PTSD and military sexual trauma treatments, and grief counseling. VHA providers must meet veterans where they are and be ready to effectively intervene during their greatest moments of need. The OIG is committed to conducting oversight to ensure all veterans have access to the high quality and compassionate care they need and deserve. Madam Chair, this concludes my statement, and I'd be happy to take any questions.